abdomen. So in doing abdominal diagnosis, we're checking in with the different organs in their body, and we're seeing which one's excessive and which ones might be a little bit deficient. So this is the way all Shiatsu massages begin and end. I'm in a lunged position over my client, and I'm using the Shiatsu principle of vertical pressure, where you use the weight of your body to apply 90-degree pressure into the target areas. Okay, so this technique is called palm walking or palm crawling, and it's a nice way to warm up the body as you're gently using the weight of your body, using the vertical Shiatsu principle, effortlessly shifting back and forth to assess the tension in the back. We're going to utilize some of the deeper techniques. We're going to use the elbow, knowing that when your elbow is flat, that's a nice firm pressure, and as you elevate it to a V, the deeper and the stronger the pressure is. So I'm going to start out in the L-shaped elbow, applying vertical pressure straight into her gluteus. And when I find that tight area, I'm going to elevate it just a little bit, do some press release to help soften and loosen the low back. Okay, here we're going to do an advanced technique where we're going to do palm crawling on the back and on the legs. So I'm adjusting my center of gravity as I move up her back and back down. Okay, so some of the finishing techniques that we would use in Shiatsu is the deep.
Reflexology is not a foot massage. It's a tool for balancing the body and the body's natural system and revitalizing the normal energy flow of the body. Now, there's different purposes and things that you can do. You can use reflexology for. Basically, any stress-related disorder is a very good, reflexology is a very good tool for any stress relief disorder. Now, if a person is experiencing stress, any kind of stress relief, such as chronic indigestion, headaches, let's deal with headaches. That's something that a lot of people do suffer with. When you're dealing with headaches, because headaches, of course, are in the head, that's why they're called headaches, you would work the big toe of either foot, left or right. And once again, you're working the thumbing motion. So if someone was experiencing a headache, you would just gently walk up the foot with your thumb, each section of the foot, and just keep going right along from the base of the big toe up to the top of the big toe. And as the person is laying there relaxing, you would talk to them and ask them how is their head feeling. And they should be feeling some type of stimulation, because what's going on is you're actually causing energy to be released and you're causing the blood to flow in the head. Therefore, you're helping that person relieve their headache. Excuse me. Another good use for reflexology is for circulation. If a person, let's say for instance, a person is experiencing poor circulation in their foot, in their leg, you would work in the reflexology right along the inside of the foot. You would work right in that area to help to stimulate blood flow to that area and to help the person's circulation to flow better. Once again, this is not a medical treatment. It's just a tool that's used to help the body's own healing mechanism and to help the body to relax so that the blood can flow and the energy can flow better and stimulate.
Which is from Thailand, but originally from India, moved down with the Theravada Buddhists into Thailand about 2,500 years ago. And it's their physical component of their medicine there in Thailand. It's a very spiritual work. It's got an intent of loving kindness and also to bring your client to a meditative state. I love doing the work. It's very intimate, and I get to interact with the client's body very almost like a dance. What I like the most about Thai massage is it gives the client energetically exactly what they need. So if they need to be revved up and given energy and, a boost, tonified, we call it in Chinese medicine, they'll get that. But if they need to just really slow down, get into their bodies and relax, they're going to get that too. We start at the feet to ground the client. The belief is if the feet are the foundation, and if the feet are in line, the rest of the body will follow. So that's why Thai massage usually always starts at the feet. And I'm going to show you a couple techniques that we use in Thai massage. The first that I'm doing right now is called palm pressing. So what we're going to do is just warm up the body, say hello in a nice gentle way by palm walking up her legs. Palm pressing is the integrative, the warm up, the say goodbye kind of technique in Thai massage. It's almost like if you know about Swedish massage, there's effleurage. It's akin to that. It's the Thai version of that. We also get to use our feet in Thai massage. So you get to use different parts of your body. You save your hands, right? You're not doing it all with your hands. So we use feet, elbows.
Well, Swedish is aimed for relaxing and to ease tension.
So you just sort of melt into the bed.
That's correct.
So Jackie's actually going to be getting our Swedish massage today, and I know because I work with her that she's got a lot of tension in her upper back. That tension happens because we work on computers every day. Is that right?
That is correct. You have a tendency to lift your shoulders up when you're doing keyboards or your mouse.
Typing, yeah.
Right. So it's very, very common for office workers.
Yeah.
You start building a lot of knots.
And you can kind of tell, can't you, once you get back there, like what areas are a little bit tighter and what need a little bit more work?
Well, absolutely. A good therapist would do, usually they would do an assessment, and they will also ask you for your occupation and your work habits. And all those will give you a good idea what to do with the issue.
Can you describe some of the techniques that you use when you're giving your client a Swedish massage?
There are 4 techniques I normally use for Swedish massage. One of them is called effleurage, which is a gliding motion using long strokes.
Okay.
And the second one is called petrissage, which consists of more of a squeezing, pulling of the muscle. You get blood circulation, tension releasing.
I didn't even know those things had names.
Oh,
I just thought you guys were doing whatever you wanted.
No, there's
a whole
technique
process
names.
to it.
Yes.
Okay.
And the next one that I use is vibration, which consists more of a little bit of a shaking. And the last one I use is friction, which helps rub some of the adhesions they may have for either hot spots or little knots. So all this feels very good.
So what you're telling me is like I should be getting a massage once a week because it's actually really good for me and I'm not just playing around.
Well, it just depends on the individual. It would be nice to get once a week.
Wouldn't it?
Once a month is the recommended.
Okay.
maintenance. And it's good for regular maintenance. So in a nutshell, massage is like brushing your teeth. So
Except you only do it once a month.
Exactly.
once a month.
Exactly. The concept is the same, that you have to take care of your teeth.
Right.
So if you get a massage once a month, the benefits could be immense because it will help relieve a lot of muscle aches, tension, stress, and it can actually make you more productive at work.
So
First type of thermotherapy, that's the therapeutic application of heat. We use this to control pain, to increase soft tissue extensibility and circulation, which then in result will it increase the range of motion and it will decrease joint stiffness. And it also helps accelerate healing. You get the influence of the hemodynamic system, the neuromuscular system, metabolic processes, and altered tissue extensibility. So these are all influenced by that thermal heat. So the hemodynamic effects obviously is that vasodilation where you get that increased rate of blood flow. You also have an increased nerve conduction velocity. Demyelinated nerves get a conduction block. You get a decreased duration of that sodium channel opening of the nodes of Reinvere. This will decrease muscle spasm. It will increase your pain threshold, which thus is in result is decrease your pain. This is what we were talking about in our previous lectures. It will decrease your strength for about 30 minutes, gradually recovers and increases over about 2 hours. So the importance of that when you're applying this is to let your patient know that, and if they're going to be using it at home as well, that they then don't want to be doing something that they're going to put demands on that muscle that it can't keep up with and re-injure themselves. The metabolic effects is that enzymatic reactions, increases that rate, increases the cellular biochemical reactions. You get increased oxygen uptake and accelerated tissue healing in that metabolic system. So as far as altered tissue extensibility, it feels there's a greater increase in length after stretch force is applied. The less force is required to increase that length. There's a decreased risk of tissue tearing. This occurs around 104 to 113 degrees of Fahrenheit for about 5 to 10 minutes is the optimal. There is some research out there that talks about being careful about heating a tissue for too long and then stretching and breaking up those collagen fibers. So that'll be something one of you, when you pick your project to do your journal presentation, you can dig into that a little bit further for us and report back on the pros and cons of using heat as an effect to get some altered tissue extensibility. Is it a good thing or a bad thing? Contraindications, these are really important. You'll want to know these for the lab practical. You'll also want to look at the rubric because there may be more on there than are on this PowerPoint. So you want to make sure that you list the ones that are in your packet when you're going to go do your lab practical, so you know what things you do not want to use heat on. And basically you want to think about those effects we just talked about. And you don't want to do it to anything where you would, where having an increased blood flow or increased metabolic effect would impair that entity. So a recent or potential hemorrhage, obviously we don't want to have more bleeding. An acute severe inflammatory conditions, again, that increased vasodilation could hinder the healing process. A thrombophlebitis, impaired sensation, we already talked about that. Probably one of the number one reasons people get sued and burned is putting it on an elderly person who might have decreased sensation, or a post-op patient that hasn't gotten their sensation all the way back from the surgery. Impaired mentation, where they can't tell you it's too hot. They could just say that feels great and it could be burning them. Malignant tumor, again, we don't want to be feeding that tumor. Irradiation of the eyes, and pregnancy of the abdomen, the pelvis, and the low back. We don't want to increase blood flow to those areas on a pregnant woman. Precautions would be a demyelinating nerve, and that would be like a carpal tunnel syndrome, multiple sclerosis. Really important with those nerves in the beginning. We really do not want that increased nerve conduction. That's just going to increase inflammation in that area. So really important to understand that and to know the healing phases again, so in the different structures. So with nerves, you're going to treat them a little bit differently than you are a muscle or a ligament or a tendon. Rheumatoid arthritis could be a precaution depending on if they're in their exacerbated state or not. A diabetic, to kind of think about that one, that's primarily going to be most likely because they have some decreased sensations, peripheral neuropathy of that nature. We already talked about the acute injury inflammation. There are going to be times when you can use heat as a precautionary. It just depends on where it's at. You might not be doing it directly to that area, but the area around it. Talked about pregnancy. The precaution would be that you could use it somewhere other than that abdomen or that low back area, that pelvic area. Somebody who doesn't have good circulation, you don't want to be overloading somebody where it just puts more blood flow into an area that they can't pump out. Poor thermal regulation, a systemic infection, edema, cardiac insufficiency, superficial metal implants in the area, an open wound. Topical irritants have recently been applied where you might hinder the effects of that or cause more irritation. Hand motor skills, reaction time needed. So adverse effects. So we talked about this, burns being the number one. Fainting, bleeding, skin and eye damage from the infrared irradiation. Avoiding tissue damage. use superficial heating agents that can get cooler during application. So that would be like